Hey, welcome back. Have you ever noticed those white or yellow little bumps under or around your eyes and sometimes even on your nose, cheek area, and even on your forehead? These are often very stubborn bumps and gets hardened up, especially as we age. Today's video is all about Milia, which is a technical name for these stubborn bumps. It's a tiny cyst which forms just under the skin. Milia is a plug of protein called keratin, which is apart from the skin, is also found in your hair, even in your nails. And this plug of protein gets trapped into the skin surface and creates a really hard little white pearly ball of a cyst. So Milia is also known with various other names like pearly white, hard bumps, milk spots, and even your stubborn whiteheads. They are usually non-inflammatory and has different causes. They can grow up to 2 millimeter in size, and while they can develop in anyone at any age, there is no ethnicity, but usually found in infants and stays up to around 4 weeks and then it disappears. But when it's found in adults, it becomes really notorious and stubborn, doesn't move and sits there for many years. When it comes to the causes, no one really knows what causes Milia to appear or why some people have more bumps than others. But studies suggest that there are certain things which can make it worse, like using harsh or heavy products. When I say heavy product, it means an occlusive products, especially if you're talking about the Milia around the eyes. We know the skin around the eyes are very thin. There's not too much of a cell integrity, so the cell renewal speed is not as good. Cell regeneration is slow, is poor. Heavy products can be occlusive to the skin, which can later lead to Milia. Other factors for Milia could be strong abrasions, either with the chemical peels or with your mechanical peels, which again can lead to flaking of the skin. It could also be due to excessive sunburn or due to some medication like corticosteroids or due to some cancer drugs. It could also be due to trauma for people who are prone to blisterings. Well, there are some myths or misconceptions which are attached along with Milia. Is that Milia occurs due to the clogged pores. This is not true because it is found due to the plugged keratin and the plugged protein found on the epidermal surface. So unlike pustule, milium, which is a technical name for a singular Milia, is not acne pustule, but is actually a plug of hard keratinized cells which has got trapped inside the surface of the epidermis. Some say it happens only on the dry skin. Well, it can happen on any skin type. It can happen on oily skin as well. Another misconception about Milia is that there is a certain link between the diet and the Milia. Well, there's quite a few evidences about the link between the acne and the diet, which promotes inflammatory acne. But till now we don't have any such evidences regarding the Milia and the diet. But as I always say in my videos, listen to your skin because skin is the best judge. If you find any kind of eruptions occurring due to certain food, so stop having that particular food. You may consult your dermatologist. Steaming your face, well, that's just going to soften the surface of the skin, which helps the professional to remove the keratin plugs. But steaming at home by yourself is not going to make any such difference. You certainly need a professional's help to deplug the keratin because that keratinized plug is very hard for you to get it removed by yourself. So there are certain lookalikes like Milia called syringoma, which is also a white yellow colored bumps on the skin surface. It is mainly due to the overactive sweat gland, which looks quite similar to Milia. There are other lookalikes like your comedonal stage acne. When you have those whiteheads, it also resembles very much like Milia. So it's always advisable to get yourself checked by a skin expert or a dermatologist to identify whether it's Milia or something else. Squeezing milia or picking it is a complete no-no. And the little bump on the skin, it's so hard, it's like a grain of sand, because milia form under the thin layer of the skin, and not in the pore. There's no opening by which plaque can escape, unlike your acne pimple. So what are the treatments of milia? Let's start with the prevention, what you can do yourself at home. So mild cases of milia just disappears on its own, like especially in infants. They are there for a few weeks and then they disappear. You don't need to do anything. But generally in adults, it becomes really hard and keratinized. Though there's not much at home products or treatments, however, there are certain procedures which you can do at home to prevent the formation of milia. Try to keep your skincare routine simple. Use a gentle cleanser, preferably which has AHAs and BHAs in the morning, and follow it with antioxidants like your vitamin C, vitamin E to prevent your skin from forming free radicals, and then complete your regimen by applying your broad spectrum sunscreen with SPF 30 at least. And if you're observing milia is mainly focused in your eye area, then instead of the normal cleanser, you can use micellar water cleanser, which is quite gentle for that delicate area around your eyes. Exfoliation is important in the prevention of milia. You need to speed up the cell renewal so that there is no blockage under the skin. So use chemical peels like your lactic acid, glycolic acid, or even your salicylic acid, but preferably in the nighttime skincare. But use it in a lower percentage, lower strength. Use your exfoliation once or twice a week depending on the need of the skin. The dead cells getting lodged under the surface and not regenerating is the lead cause for the formation of milia. After peeling, it is very important to follow with a good moisturization. A good moisturizer protects your skin's barrier layer and also prevents the skin from flaking. Using of chemical exfoliant is better than using a mechanical exfoliant. Mechanical exfoliants can be harsh and strong, especially for around the eye area. Also, you can go with the retinols, which helps in speeding up the cell renewal and the regeneration of the cells. If you have more milia around the eye area, don't go with the prescription strength retinol. Go with the lower strength of the ingredient. So as I had said earlier, don't go with heavy products which can be occlusive to your skin, like your Vaseline, petrolatum, linoleic acid, your mineral oil. So try to avoid these ingredients using, especially around your eye area. So these were some of the ways you can do which you can do at home to prevent milia. But as I said, milia is a very hard plug of keratin lodged deeply into the surface of the skin, and it is very difficult to get it removed by yourself at home. So you do require medical intervention to get it removed by a skin expert or a dermatologist, and sometimes even by your expert estheticians. So professionally, there are different methods through which you can get rid of that hard plug, that cyst, from the surface, like lancing or incision. The first one, which is the most popular one, is de-roofing, which is done through a comedonal extractor or a lancing tool or a sterile needle. So it requires a minor incision. So the incision helps in opening the mouth of the cyst, and then the contents inside it is gently flicked out. Then there's an electrocorticoid or an electrodesiccation, which is a technique through which a high current electrode is given to dislodge the keratin. We also have chemical peeling. You can apply strong peels on that spots where you have milia. But chemical peeling is not very recommended for the dark skinned people because it can give post-inflammatory hyperpigmentation. So if it can be avoided, it's best to avoid it. Then another technique is cryotherapy, which is where liquid nitrogen is given to freeze milia. Again, this is a very tricky thing for the milia around the eye, especially because skin around the eyes are very delicate and thin, so it's best to avoid. There are a number of ways to treat or prevent milia, but it's you who have to decide which one is right for you. And should you be getting it removed at all? If it's really not bothering you, just leave it like that. But if it's cosmetically really bothering you, then you should take an expert advice. Why I'm saying this is because there is no such evidence which proves that milia after treatment will not come back. But if the skin is prone to recurring milia, it's best to prevent it. Only way to prevent and minimize milia is speeding up the cell renewal so that there is no lodging of the dead cells under your skin. For that, exfoliation is the best way, or your retinols. These are some of the ways which will help in speeding up and slowing the dead cells and getting it removed so that there is no lodging of the dead cells under your skin. And also moisturization. It is very, very important to moisturize your skin, to keep your skin healthy, to keep your barrier layer strong is utmost important. Hope this information was useful to you. Make sure to subscribe my channel and hit the notification bell. If you have any comments or suggestions, leave it in the comment section. Thanks for watching and see you with my next video. Till then, bye bye.